Welcome to the Victory Education Lounge. We're thrilled to have you join us for another exciting episode. Before we dive in, please like, subscribe, and leave a comment below sharing your thoughts or experiences. Your engagement helps us create more valuable content and fosters a community dedicated to health and wellness. Today, we're exploring part 136 of our series, Emerging Therapies for Insulin Resistance. As our understanding of insulin resistance grows, so do the innovative approaches to treating this widespread metabolic issue. Let's dive into some of the most promising new therapies on the horizon. Ever wondered why insulin resistance is such a hot topic in today's health discussions? The chatter around insulin resistance isn't just because of its growing prevalence, but due to its far-reaching impacts on our metabolic health. Let's break it down. Insulin, a hormone produced by your pancreas, is like a key that unlocks your body's cells to let in glucose, the sugar that fuels our bodies. But in insulin resistance, this key doesn't work quite as well. The locks on the cells become rusty, you could say. As a result, glucose struggles to enter the cells, leading to a buildup of sugar in your blood. And why is this a problem? Well, high blood sugar levels can cause a host of health issues, including type 2 diabetes, heart disease, and even certain types of cancer. But it's not just about the sugar. Insulin resistance can also lead to an overworked pancreas, as it tries to compensate by producing more and more insulin. Over time, this can cause the pancreas to wear out, disrupting the delicate balance of your body's insulin production and setting the stage for type 2 diabetes. Now, you might be thinking, okay, but why is insulin resistance on the rise? That's a great question. The answer is complex and multifaceted, but lifestyle factors like a poor diet, lack of exercise, and excess weight, especially around the waist, certainly play a role. Genetics and certain health conditions can also increase your risk. But here's the good news. Insulin resistance is not a life sentence. With lifestyle changes and the help of emerging therapies, it's possible to improve your body's responsiveness to insulin and maintain healthier blood sugar levels. Now that we have a better understanding of insulin resistance, it's time to explore the promising therapies emerging to combat it. These innovative approaches give us hope that we can turn the tide on this widespread metabolic issue and help individuals live healthier, more fulfilled lives. So stick around as we delve into the exciting world of insulin resistance therapies. First on our list are SGLT2 inhibitors and GLP-1 receptor agonists. These therapies are at the forefront of innovation in tackling insulin resistance. Let's start with SGLT2 inhibitors. These work by reducing glucose reabsorption in the kidneys. This action helps lower blood sugar levels, which can be a significant benefit for those with type 2 diabetes. Additionally, these inhibitors have been shown to promote weight loss. However, they do come with some potential drawbacks, including an increased risk of urinary tract infections and, in rare cases, ketoacidosis. For instance, the New England Journal of Medicine published a study showing that the SGLT2 inhibitor empagliflozin reduced cardiovascular events in patients with type 2 diabetes. Next up are GLP-1 receptor agonists. These therapies work in a few ways. They increase insulin secretion, reduce appetite, and promote weight loss. These effects can be a game changer for individuals struggling with insulin resistance. However, they are not without potential side effects. Some individuals may experience gastrointestinal issues, and there's a potential risk of pancreatitis. However, a study published in The Lancet showed that semaglutide, a GLP-1 agonist, led to significant weight loss and improved cardiovascular outcomes. It's important to remember that while these therapies show promise, they are not without risks. As with any new medical therapy, it's crucial to weigh the benefits against the potential side effects. Conversations with your healthcare provider are vital when considering these options. Despite some potential side effects, these two therapies show great promise in managing insulin resistance and improving metabolic health. Both SGLT2 inhibitors and GLP-1 receptor agonists have been shown to have positive effects on insulin resistance, and ongoing research continues to expand our understanding of their potential benefits and drawbacks. As we continue to develop and refine these therapies, we move closer to a future where insulin resistance can be effectively managed and potentially even reversed, paving the way for healthier lives and brighter futures. Next, let's delve into the world of dual GIP and GLP-1 receptor agonists and FGF21 analogs. Our exploration today brings us to the doorstep of dual GIP and GLP-1 receptor agonists. These fascinating therapies are designed to harness the benefits of both GLP-1 and GIP activation, potentially providing a more effective treatment than therapies targeting a single receptor. Although these dual agonists are still in clinical trials, early results are promising. For instance, studies on a drug called tirzepatide have shown it to outperform existing SGLT2 agonists in terms of glucose control and weight loss. However, as we're still in the early stages of understanding these therapies, the long-term effects are yet to be fully understood. Next on our journey are the FGF21 analogs. These therapies are gaining attention for their potential to improve insulin sensitivity and reduce inflammation. They're even showing promise in the treatment of fatty liver disease, a condition often associated with insulin resistance. A phase 2 clinical trial published in Cell Metabolism revealed that an FGF21 analog improved insulin sensitivity and reduced liver fat in patients with type 2 diabetes. However, it's important to note that these analogs currently require injection and are still in the clinical development stage. As with all emerging therapies, it's essential to approach these treatments with a balanced perspective. The potential benefits of dual GIP and GLP-1 receptor agonists and FGF21 analogs are indeed exciting, but it's crucial to remember that these therapies are still in development. We must await further research and clinical trials to fully understand their long-term effects and potential applications. Although these therapies are still in development, early results are encouraging, painting a promising picture for the future of insulin resistance treatment. Now let's turn our attention to mTOT modulators and selective PPR modulators. These two emerging therapies are creating quite a buzz in the medical world, and here's why. First, we have the mitochondrial target of Thiazolidinediones, or mTOT modulators. These are designed to improve insulin sensitivity, a crucial factor in managing insulin resistance. Unlike traditional Thiazolidinediones, these modulators aim to achieve this without the accompanying weight gain, which is a common side effect of the older generation of insulin sensitizers. However, it's important to note that mTOT modulators are still in the early stages of development, and their long-term effects are yet to be fully understood. Despite this, preclinical studies are showing promise. They suggest that mTOT modulators could potentially bring about an improvement in insulin sensitivity without the side effects seen with earlier therapies. Next we have selective peroxisome proliferator-activated receptor modulators, also known as selective PPAR modulators. These target specific PPR subtypes to improve insulin sensitivity, but with fewer side effects. However, it's worth noting that some candidates have faltered in late-stage trials due to safety concerns. Despite this, a study featured in Diabetes Care demonstrated that a selective PPR modulator improved glycemic control without the fluid retention typically associated with traditional PPAR agonists. In essence, both mTOT modulators and selective PPAR modulators represent a new wave of potential treatments for insulin resistance. They aim to improve upon the drawbacks of previous treatments by offering improved insulin sensitivity without the typical side effects. However, these therapies are still in the research phase and more studies are needed to fully understand their potential benefits and risks. While these therapies are still in early stages of development, they offer a new approach to improving insulin sensitivity without the typical side effects. Finally, let's talk about an intriguing non-invasive approach: gut microbiome modulation. The human gut is a bustling metropolis of microorganisms, and it turns out they have a significant role to play in our overall health, including our metabolic functions. The potential of gut microbiome modulation lies in its ability to alter this internal ecosystem to improve insulin sensitivity. But it's not all smooth sailing. The complex interactions within our microbiome mean that results can vary widely between individuals. However, the promise of this therapy is undeniable. A study published in Nature Medicine, for instance, demonstrated that fecal microbiota transplantation from lean donors significantly improved insulin sensitivity. Perhaps the most exciting aspect of this therapy is its potential for personalization. Imagine a future where treatments are tailored to your unique microbiome profile. The ability to personalize treatment based on individual microbiome profiles makes this therapy an exciting area of ongoing research. We've covered a lot of ground today exploring 7 emerging therapies for insulin resistance, from SGLT2 inhibitors reducing glucose reabsorption and promoting weight loss, to GLP-1 receptor agonists increasing insulin secretion and reducing appetite. We've also dived into dual GIP and GLP-1 receptor agonists, FGF21 analogs, and mTOT modulators, all promising improvements in insulin sensitivity. we've unveiled selective PPAR modulators targeting specific PTPR subtypes to improve insulin sensitivity with fewer side effects. And finally, we've touched on the non-invasive potential of gut microbiome modulation, providing personalized treatment options based on individual profiles. It's an exciting time in the field of insulin resistance therapy, with research and development continuously pushing the boundaries of our understanding and treatment options. Remember, the road to better health is a journey, and every step, no matter how small, brings us closer to our destination. In conclusion, the field of insulin resistance treatment is evolving rapidly, with many exciting therapies on the horizon. From novel pharmaceutical approaches to microbiome modulation, these emerging therapies offer new hope for those struggling with insulin resistance and related metabolic disorders. However, it's important to remember that while these therapies show promise, they are not yet widely available and require further research to fully understand their long-term effects and safety profiles. Moreover, they should be viewed as potential additions to, not replacements for, the foundational pillars of metabolic health: a balanced diet, regular physical activity, adequate sleep, and stress management. As we look to the future of insulin resistance treatment, it's clear that a personalized, multifaceted approach will likely yield the best results. By combining the most effective emerging therapies with established treatments and healthy lifestyle habits, we can hope to see significant improvements in the management of insulin resistance and its related health issues. Thank you for joining us in the Victory Education Lounge for this exploration of emerging therapies for insulin resistance. If you found this video helpful, please give it a thumbs up and share it with friends who might benefit from this information. Don't forget to subscribe for more content on health, nutrition, and cutting-edge medical research. Until next time, stay informed, stay healthy, and keep striving for victory in all aspects of your life. Disclaimer: the information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decision should be discussed with a licensed physician or qualified healthcare professional, especially if you have existing health conditions or are taking medications. Until next time, stay healthy and keep learning.